everyone, we're here at the Main Street Medical Clinic in Brampton, and I'm really excited about today's wellness segment. As a registered massage therapist and an internationally certified infant massage instructor, I have spent the last 18 years working alongside other healthcare professionals to show parents what they can do to help with ailments such as gas, colic, teething, sleep disturbances, and many more. I'm really excited because today we're going to speak to a family doctor and who's a mother herself on these issues and ask for some of her advice, as well as getting a parent's perspective. So come on inside with me. Well, it's been a long time since I've been kept awake at night with a crying baby due to gas, colic, or any myriad of reasons. However, as a parent, we don't soon forget what those nights were like. I have with me now Lisa Pomeroy and beautiful baby Brooke. And if anybody knows firsthand what a sleepless night is like, it certainly would be you. Welcome, Lisa.
Thank you for having us.
And Brooke, hello, beautiful baby. So, Lisa, you took a workshop with me a few months back on baby massage. Why did you come?
About at 1 month old, Brooke started to experience some gas problems, and it was recommended that we take the infant massage course, and it was very, very effective.
Great. Now, I also made some recommendations of some homeopathic medicines that I have found to be incredibly helpful, and so have many of my patients. Did you use them?
I do, and I do not leave home without them.
Oh, is that right? Which one have you used for gas?
Costantol.
Excellent.
And it's very effective, often with 1 dose. All
right. So now that you've gotten sort of over that hump, the baby massage program grows with your baby as well as the entire pharmacy with Boiron.
Yes.
So what seems to be the issue now?
As you can see with the red cheeks, we are experiencing some teething right now.
Right.
So we are using camellia.
Right.
And it's also very effective also with 1 dose. So effective that I've recommended it to a neighbor who has a newborn as well. And she swears by it too.
Oh, fantastic. Well, you know what? One thing I didn't show you in the workshop that I'd like to show now and show everybody at home as well is a great massage technique to do inside the mouth. Not only is it safe and effective, it's great to do in conjunction with dosing with camellia. Just take a baby washcloth and wet it. And then put it around your little fingers like this and put it in the freezer. Just about 10 minutes before you want to use it, take it out because you don't want these to be jagged edges. Then you're going to go inside the baby's mouth and massage along the gum line firmly, both the bottom and the top, very firmly to counteract the pressure of the tooth erupting.
Right.
And of course, symptoms of teething can last for a long time. This will help with pain. It'll decrease some of the inflammation. And of course, in conjunction with camellia, you're going to get some sleep real soon.
Oh, good.
Well, thank you so much for bringing in beautiful baby Brooke, and continue with the baby massage program as it grows, because of course for bonding and relaxation, you don't want to stop.
Thank you so much for having us.
And thank you, Brooke, for coming. Yes, thank you. Now, of course, if you'd like any information, whether it be about baby massage or, of course, this wonderful pharmacy of products from Boiron, you can visit boiron.com. And if you have any health and wellness questions, don't hesitate to send them my way to Margaret at reallifeoncts.com. Babies and toddlers are precious to all parents, and of course, taking care of their health and well-being is paramount. Well, I'm really excited to have with me Dr. Priya Seppal, who's not only the owner of this fantastic busy clinic, but she is also a family doctor and a mom, so she knows firsthand the importance of this topic. So welcome, Dr. Seppal.
Well, thanks, Margaret, for having me.
Okay, so now with a walk-in clinic and in family practice, when new parents come in, what are some of the common ailments that they're coming to seek advice about?
Well, I think once most parents get over the sleepless nights and how to feed the baby and how to change the baby, I think one of the most common concerns that parents will come in with is a child that's crying for no apparent reason. It's a child that most likely mom, dad, grandparents, aunts, uncles, neighbors have sort of said, well, the baby's fed and they're warm and they're changed and they're, everything seems fine, but they're crying for no reason. So colic is generally one of the big things, and we often will see colic in children under the age of, it starts usually within the first 3 months. They cry for a period of 3 hours at a time, usually early in the evening, and this can go on for about 3 months. So the rule of 3 is generally applies. It can affect up to 20% of children in the newborn period, and it can be very frustrating. And so there are a number of things that we can certainly try to help the babies, and a lot of times parents will have come in and said, mom said, throw a blanket in the dryer and put it on the tummy and rub the tummy, or I've exercised the knees, or I've tried, a number of things and it's not working, and there's nothing that we can do to settle this baby. So generally what we would say to parents, if we can establish that there's nothing sinister going on, so the child's not vomiting, the child is not sort of very lethargic, the child is feeding well, the child is not having bloody stools. Once we can establish that there's nothing really horrible going on, then
Right.
you know what, we've got a great armamentarium. I mean, you've talked to me about massage, and I know that works well, and then there's this fantastic product that helps with gas, and in fact, I was introduced to it when my second baby was crying and colicky, and my family doctor actually presented this to me and said, give this a try, and it worked wonders.
Yeah, now the medicine you're talking about is Cosentol from Boiron, and I know firsthand as a parent as well, and I tell a lot of my patients, so I'm thrilled to hear that your family doctor recommended it for you as a parent,
Yes.
so that's really, really helpful.
Yeah.
Now, another ailment that we often hear a lot about that keeps us awake is teething.
Yeah.
You know, what is teething, and what do you recommend to your patients?
Well, teething, I mean, as I think most commonly people will say, well, the kids are drooling. And certainly teething symptoms can start long before a tooth actually erupts. And so some kids will, you know, get their first teeth somewhere between 6 and 8 months. So oftentimes we'll see the drooling, which can precede the tooth by months. Children may develop a rash to their cheeks. Oftentimes parents will come in and say, my child must have an ear infection. They're pulling on their ear. They can get a bit of diarrhea. They can certainly get low-grade fevers, not often. They can often go off their feeding, so they may not be interested in breastfeeding. They may not want to nurse. They may not want to take solids. A bit of irritability, crankiness, difficulty sleeping, gums that are red and hard. They're putting things in their mouth. They're putting their fingers in their mouth. So I think a lot of those symptoms that we've all seen, and they could have, and some children breeze by and have absolutely no symptoms, but for most children they do have, you know, 1 or 2 or in some unlucky children, all of those symptoms.
Right. Now, of course, and we want to be able to do something as parents. So Boiron has Camellia, which is 98 or 97% parent satisfaction rate, and as you can see, really easy to carry around in your diaper bag, easy to administer, and of course, it's effective. No drug interactions, no side effects, no toxicity,
very
and
safe.
it works.
Yeah, very, very safe to use. And you know what? It's again one of those things that you can have at home and you can try. You know, you want to make sure that you do what you can before you rush into the office. And if you can comfort your child, you know, and they're easy to administer. They can be administered over and over again in a period of time.
Yes.
And very safe to use. And sort of, you know, going back to some of the old home remedies that we have.
Right.
So.
And of course, this doesn't just deal with the pain of teething, but all of the symptoms that you're talking about, the irritability, the swollen gums, the mild fevers, all of those things that will help to address.
Yeah.
Now, of course, cold and flus, that's another big thing that you'll hear about, cough, cold and flus. And what do you tell patients then?
Well, you know, we're really sort of at a bit of a crossroads in that as of the fall of 2009, any of the over-the-counter cold and cough remedies are not to be administered to children under the age of 6. So parents will come to us and say, well, what do I do? My child's got a runny nose, they've got a bit of a cough. What can I give to them? The humidifier's not working, the vaporizer's not working, you know, all that sort of stuff. And again, this company has a great product line for runny nose and cough and sneezing and flu-like symptoms.
Right.
So, you know, again, one of those things that you can certainly try at home along with your home remedies before you come in. Certainly if the child's lethargic, has a fever, not feeding well, if you're worried about flu-like illnesses or influenza-like illnesses, obviously we want you to come in. But for that common garden variety cold, cough symptom that you can certainly do something about and relieve some of their symptoms, great products again.
Right. Now, Dr. Supple, I know that you weren't familiar with these two, so I'm going to do a little bit of education as well. What we love and we're talking about is an entire pharmacy for our kids here. And, you know, for 1 year and older, and as a massage therapist, I do a lot of work with anxiety in children and ADHD, and both Quietude, which is great for mild sleep disturbances, and Nervita, which is amazing also for lack of concentration and nervousness. This, in conjunction with massage and a lot of the other things, of course, after seeing your doctor's advice, seeking a doctor's advice, are a great thing to have in your medicine chest as well.
Yeah, you know what, I think it's a fantastic product line for the entire family to try and keep us healthy and out of the doctor's office until you really need to be here.
Exactly, which is why this walk-in clinic is so busy. I know how busy you are. Thank you so much for your time and your expertise, and not only as a doctor, but as a mom, because that really matters.
Well, thanks for having me, Margaret. I appreciate it.
Thank